Good morning, everybody. We are happy here to have two people from the University of Virginia. I'm thrilled to have to speak with today because I want to share your good work with our audience. The first being Teagen Medico and the second being Dr. Jeffrey Gander. Good morning.
Good morning. Thank you so much for having us today here, Bill.
We appreciate it.
Good morning, Bill. Thank you very much. We are very honored and happy to talk about the stuff we're doing, but also how much fun we're having doing it.
Let's start with Teagen. Teagen, tell us a little bit about what you're doing, the magic that you're doing at UVA. I want to hear about that. Can you share that with our audience?
Sure. Well, first, it's a big team effort. So I'm speaking on behalf of lots of people who are doing great work. So what we have started doing about a year ago is thinking about child food insecurity and how we as healthcare providers and a healthcare organization at UVA can address this problem in our community. And it was really inspired by just sort of the observations of people struggling during the COVID-19 pandemic. So it started off with a partnership with the Charlottesville Local Food Hub with their Fresh Pharmacy program. So this is a program that they had already been doing where they were working with local farmers, collecting locally grown fresh food and delivering it to families. And so what we did is we started to screen for food insecurity at some select clinics at UVA, identifying food insecurity and really referring families to this program. So that was one side of what we were doing.
Can I just ask you a quick question about that? I'm sorry to interrupt. So you're a dietitian, and that's how this is the department that you're in, and you were collecting data. Did you collect the data? What did that look like?
So we haven't started collecting data yet, but that is one thing that we want to do. So yes, I'm a dietitian. I specialize in pediatrics. So I'm everything nutrition, oral tube feeding, intravenous nutrition, all of it I'm sort of involved with. And so Dr. Gander had approached me and one of my colleagues to sort of get these initiatives off the ground. And so we actually didn't do any baseline data collection or any sort of formal community needs assessment. It was just sort of the sense that people were struggling. And we thought, well, why don't we go ahead and try to do some of these programs and see what happens. See if they're being used and see if we can expand.
I love it. So you were able to then connect the dots in the community to help people who were dealing with food insecurities to get the help that they needed. Can you, for our audience, share exactly what food insecurities are?
Yeah. And I thank you for that question, because one thing that I've learned is that everybody kind of has a different idea of what this means and a different image of a food insecure person, depending on what our sort of preconceived notions are. So one of the main definitions that you will find quoted over and over again in the literature on food insecurity, that it is the limited or uncertain availability of nutritionally adequate and safe foods, or the limited or uncertain ability to acquire foods in socially acceptable ways. That's the official definition. The USDA, so the U.S. Department of Agriculture, subcategorizes food insecurity into two types: low food security and very low food security. Low food security exists when households have to alter the quality, variety, and desirability of their diets, but the quantity of food intake is not yet affected. Very low food insecurity exists when the quantity of food intake is disrupted. And I think it's important to emphasize here that reduced quality of the diet due to lack of resources is still food insecurity. Food insecurity is not starvation. And even with very low food security, reduced food intake doesn't need to be all the time. It can be intermittent, and it usually is.
Mm-hmm. I think people don't understand, in mainstream America, that they're countless children going home to empty refrigerators or empty counters, and they don't really, there isn't a family plan for getting food. I had a question about the impacts really on health, and if you could share any of the information that you may have, just like off the top of your head, on in food insecurity and a child's health? What does that look like? What are the impacts there?
So there are several associations with numerous negative health outcomes related to health, development, and actually healthcare access. And these are associations, so we always have to be a little bit careful about questioning the mechanisms. Like, are we dealing with the consequences of poor nutrition, or are we dealing with other social determinants of health that coincide with food insecurity, or maybe a little bit of both? But there's pretty good evidence to suggest an independent effect of food insecurity on some outcomes, particularly those related to healthcare access. So delaying medical, dental, and mental health care, which in turn has really big implications for health outcomes.
Wow. Right. It really is, what you're doing now is really the most basic in making sure we can keep our children healthy. Can you share with me what a healthcare provider might do if they're suspect of the, because we don't expect every healthcare provider to be aware of every issue. But are there signs, are there things that they can do to say, wow, we're a little bit worried about this, or can they point to somebody? Is there an action step they can take?
Yeah. So, I know Dr. Gander is going to talk a lot about some of the initiatives that we've done at UVA. And I do think that more and more healthcare organizations are considering things like prescription programs, meal delivery services for patients with chronic disease, and even some on-site food pantries. And I think we'll see more and more of that into the future as healthcare organizations become more think about more innovative ways of servicing patients. But in the meantime, there's still a lot of concrete actions that healthcare organizations and individual providers can take. So one thing that we really emphasize is screening for food insecurity. And this can be done in a pretty streamlined fashion. There's a food insecurity screen. It's called the Hunger Vital Sign. It's 2 questions. It's validated, and it can be done on intake. So people come in for their appointments, they get asked a bunch of questions, and these can be 2 questions that can kind of be integrated in there. And then if someone screens positive for food insecurity, knowing what resources are available, whether that's a national resource, a state resource, or even a lot of community-based organizations. We can talk about Charlottesville a little bit. Charlottesville has a very rich community of people and organizations very active in the food access space. So just knowing what they are and being able to connect patients to services that already exist is one simple option. And there are website tools, there are phone number based tools that can be provided to families that they can just put in their zip code and learn about food resources hyper local to where they live, because we know that transportation can also be a big problem, a big barrier for a lot of people. So I would say, 1, screening people, identifying who they are, and then connecting them with resources that may already exist.
Can you share with us what those 2 questions are? Can you tell us?
Yes. I always have to, they're very similar, so I always have to look them up real quick, make sure I'm saying the right thing. Okay. So the first question is, within the past 12 months, we worried whether our food would run out before we had money to buy more. So it's a yes or no response. And then the second question is, within the past 12 months, the food we bought just didn't last and we didn't have money to get more. And answering yes to either one of those questions is a positive screen.
Gotcha. Okay. And then are there places that collect that data? So are there ways that, is there a clearinghouse where that information goes? Is that passed on beyond the patient, beyond the individual?
Yeah, not in a centralized fashion to my knowledge, but that's something that we're trying to do at UVA Children's. Mm-hmm. We've started screening on intake when kids come into the our specialty clinic building. And so we are able to collect that data and run reports on it.
Well, it's interesting. People don't think of that until they start hearing it more and more and more. And they're like, wait a minute, this sounds like something bigger than an occasion. And so that's why I was curious. I'm glad to hear you've started that process. And I'm super grateful you're here today. Thanks for all your good work. I really appreciate it, Teagen. Doctor, can you please share with the audience your background
Sure.
as a physician, what you do? Can you share with us on that?
Absolutely. So I'm a practicing pediatric surgeon, I grew up in the Northeast of New Jersey, and I went to medical school there, and I did a surgical residency and then a fellowship in pediatric surgery at Columbia Presbyterian up in New York City. And then in 2014, I moved down here to Charlottesville to start my practice and to join the faculty. And I also work at the School of Medicine teaching students. My interest in food insecurity and helping people is just a lot had to do with how often I was seeing my own patients with similar problems.
And your patients are, just to interrupt a sec, your patients are, can you tell us about your patients? What type of patients you have?
Absolutely. So my patients run from neonates, babies born premature, really up until early adulthood, 18 to 21. And I'm a pediatric general and thoracic surgeon, so that could be appendicitis or cancers, lung malformations, congenital malformations, gallbladder disease. It's pretty broad. But anyway, what I was noticing is that, especially in my teenage population, a lot of them were overweight and kept coming in with similar kind of weight related issues such as gallstones. And that kind of got me thinking about, how's there a way to prevent some of these diseases are happening, but also to help them so that as they grow, get older, they have a long life ahead of them, that they're not going to be having chronic diseases such as diabetes, high blood pressure, sleep apnea throughout their whole life.
And which, of course, we're always interested in lowering the risk for those illnesses because so many are a precursor to cancer. Dr. Graham Colditz from the nurses study at Harvard and now from Washington University in St. Louis had said that really cancer prevention starts very young, really with with eating. So
I totally agree. I think it's the American Cancer Society. I think their last paper was saying at least a third of cancers are related to obesity and being overweight.
It's a struggle. I myself have struggled with it, a lot of my life. It's really, it is a struggle, and it is a real culture investment.
Yep, I agree.
So can you share with us how you connected the dots? Like, you've got these kids coming in, they're sick. Is any of this preventable? You're probably thinking, what can we do to prevent this? We've gone to their refrigerators. We know there's several things we can do to prevent this, but go ahead to talk. Was there a tipping point for the inspiration of this project?
There was. I remember speaking with a 15-year-old boy after he had appendicitis, which is usually a fairly straightforward operation, but he was over 300 pounds, and which made it much more challenging. And so in the after visit, we were kind of talking about, what are some healthy habits he can start to do? And I said, tell me typically, what do you eat every day? He's like, well, I often skip breakfast, and then I eat whatever the school lunch has, which is, pizza. And, and then I come home and my mom, sometimes will make something. And I said, gosh, that's not, an ideal diet, to sustain you, but also to prevent you from gaining weight. And so then, as Ms. Teagen was mentioning, there's a lot of different organizations here in Charlottesville that are in the food insecurity space. And then I learned about a group called Cultivate Charlottesville, which amongst many things is also looking at how can we help school lunches. Now, I do not want to disparage school meal programs because I really think they really are an excellent safety net. And I know the schools do the best they can with the budgets that they have with those. They're critical. I don't want to disparage them at all.
No,
but I know that they can be improved. And so this group, Cultivate Charlottesville, works in that space. And so I started meeting with them. And then I mentioned what I do. And they said, you know what, you really should look into this group called Local Food Hub, as Teagen started to mention. And they have a partnership with a bunch of farms in the area. And you can write a prescription for healthy, fresh food for your patients. And that's kind of how it all started. And I knocked on Teagen's door one day and said, hey, I've met some really great people who are doing some really neat stuff. Gosh, we should partner with them. And that's kind of how it got started.
Well, I love it. I love it because, The one thing we can do in this work is try to keep people out of doctors' offices. And we can do that by making sure there's some healthier options up front. And I know options and choices are tough for a lot of people, especially those that are dealing with several kinds of inequities. But the fact that you're connecting the dots for them, you're able to provide them healthier diets, healthier foods, with the idea of lowering risk for not only that patient but the whole family.
I mean, that's an excellent point, because both Teagen and I are pediatric providers, and that's kind of where it starts with. They're kind of, those children are the way to get the other families involved, and hopefully start to see these healthy choices are great, and now I have a little bit more money to use for something else, instead of having to.
And healthier options are becoming much more affordable. We used to be very active in something called the 9-minute meal, which is, we had figured it took about 9 minutes to go through drive-through. And what can you make in that amount of time? Well, lots of great things, healthier, less expensive, in a faster time. And there are some models out there where it can be done, but it isn't always easy. I remember speaking to a group of people on this very issue, and we were talking about soup kitchen that was serving organic meals. There was a lot of great vegetable, a lot of that kind of thing. And this one woman said, we make these choices to sometimes eat at fast food restaurants because it makes my kids feel normal. This was a homeless family. I thought, wow, that's what makes them feel normal. And I get that on some level, but I didn't even think that was even a possibility. And so the fact that, in my observation, when we see programs like yours and you normalize the importance of it, and it makes it not only a healthy choice or a healthy option, but it's also a great thing to do. I mean, you're connecting people to farm co-ops, and you're involving, you're really investing in a culture change here. And one day those experiences at farms are going to feel more normal than the drive-through restaurant.
And we try to make it as convenient for people as possible. I mean, there's so much involved in people's health, and this food insecurity is just one part of it. But as Teagen was saying about transportation, food gets delivered directly to them. That way they don't have to miss school, miss work.
Is the food always delivered, or are there options to pick it up? It's always delivered to homes. Is that correct?
It is. I think eventually, maybe when our COVID pandemic goes away, we may give the families the option to come pick it up. But at least now, with difficult transportation, but also not wanting as many people to come to the hospital.
Right, you don't want to further the risk
unless you really need to.
I get it. So, what year did you both start doing this? What year was this?
As the pandemic was hitting, honestly. The program officially started in the fall of 2020, but the ideas of it started around March 2020. And I was mentioned earlier about this group, Cultivate Charlottesville. They had set up a day during the spring break in April 2020, when students are out and they don't have access to their usual school lunches, and we're handing out lunches. And that's kind of where a lot of that idea started. And so now our Fresh Pharmacy program has been in place for a year. And then for about the last 6 months now, we started a clinic-based healthy food pantry that people can access the day that they come in for their routine vaccines or whatever visit they're going to.
Wow. And then how is that how do you regulate or manage that one piece when people come in? What does that look like, the pantry?
So Teagen said this earlier, everybody, for whatever reason you're coming to the clinic, is screened for food insecurity. And so if you screen yes, one of our social workers comes meet with the family or the child and talks about what programs they're eligible for, including the Fresh Pharmacy program. And then they said, do you need food today? And if they say yes, we give a list of some food that Teagen and one of our other partners, Olivia Obertello, had put together. Non-perishable food items that we believe are low salt, low sugar, oatmeal, that sort of thing, stuff that's healthy for you. And then they can take food that day. And then we monitor it. We originally got some grants from Kroger's foundation, and
Right.
they've been a really great partner for us.
Mhm.
And we've continued to work with them. And then UVA Children's is also contributing to that, as well as some other local citizens as well. So that actually has been eye-opening how many different people have.
Well, we know the important work that UVA Children's is doing, and I speak for myself. I'm so grateful to have you both doing the work that you're doing, bridging the gap on some of these critical issues, providing food really at people's fingertips and when they need it most. And, like, there's nothing worse than being in the hospital, being hungry, and then going home not feeling well to an empty kitchen. So, that's incredible work, and it's very much needed. Is there a way that people can support this work? How can they support? I know we're going to put links up about your backgrounds and how they can be in touch, but is there a way that they can be part of this and support this work?
Yeah, we do fundraise through UVA's foundation.
Mhm.
All that money goes directly to purchasing food or to the.
Right.
So none of these families are charged any money.
Right.
It's totally free to them.
And for those who wish to kick in and help out, they can go to the UVA website,
Yes.
to their foundation website. And is there a drop down or something that they can click on where they can say, okay, we'd like to?
If you say UVA Children's Fresh Pharmacy, and that's a pharmacy with an F.
UVA Children's Fresh Pharmacy. That's good.
Right.
Okay, we like hearing that.
Mhm.
What can we do? What can our audience members do in their own communities to do what you're doing or move the needle in some way so those kids that we suspect of not really having the access they should, how can they help?
I would say just recognizing that it is a problem, and it's maybe even underestimated how many people have food insecurity,
Mhm.
and that also that it's not a personal defect that, oh, you're obese or you are
Right.
unhealthy because you don't like to eat healthy food. They may not have access to it or may not be able to afford it.
It's a
So
chronic health issue. It's epidemic, it's chronic, would it be reasonable for people in their communities to reach out to their local hospital to ask them maybe if they knew a way they could help them
Absolutely.
bridge that gap? Would that be maybe a good step?
Absolutely. Local health systems have a lot of experience with taking care of patients and a lot of access to funds. And I think they can really do a lot for their local community.
Yes, they can. And they have a lot of information. They understand where they're sending people. So you might want to speak to a patient advocate or a social worker at a hospital to see how you might be able to help in your community.
I agree.
So that's great. I love what you both are doing. I'm so glad you were here to join us today. I hope we can work together in the future to support you in some way. And and appreciate you being here. We understand that when we work to prevent disease and lower risk, it starts at our table. That's where all this starts. It starts at our table. And we have an opportunity in many cases to lower that risk. And when access isn't available, there are some solutions out there that we're all working on to make happen. So thank you for your important, good work. We're so grateful to have you here today.
Thank you very much. It was great talking to you. We really, really appreciate it.